Thank you for joining us today to celebrate 99 days until Medicaid expansion takes effect in Oklahoma. My name is Emma Morris. I'm the Healthcare Policy Fellow at the Oklahoma Policy Institute, and I'm excited to be here with y'all and for everyone to hear what our incredible speakers have to say. So it has been a really long road getting here, 3 months out from Medicaid expansion taking effect. And there were a lot of really great people doing a lot of really great work long before I entered this space. We're very thankful for all the hard work that so many advocates and policymakers have done to get us here. So today we'll be hearing from a number of speakers representing a wide range of interests about how important Medicaid expansion is going to be for all Oklahomans. And our stellar communications team is behind the scenes monitoring the comments on the various platforms that this is streamed on. So if you have a question, put it in the comment section and we will answer those at the end. So before we begin, I want to do some quick level setting about what Medicaid expansion actually does. So states open up Medicaid, or in Oklahoma, it's called Sooner Care, access for working age adults who don't earn enough to get insurance elsewhere. And in Oklahoma, that's a lot of people. We have the second highest uninsured rate in the US. About 14% of Oklahomans are uninsured. So when people get Medicaid, they can finally see a doctor, they can fill those prescriptions. It's really, really important. We know that when people can afford to get quality, timely health care, they do get quality, timely health care. For everything from primary care to emergencies to mental health, all of those things become available. And all Oklahomans deserve the opportunity to access those things. All Oklahomans should be able to see their doctor, and that's what expansion will mean. So the security that comes with access to care has ripple effects. People who can enroll in expansion are better able to find and hold a job, and they're better able to parent. And the effects go outside of the individual and their family. We'll feel these ripple effects across the state. Medicaid expansion is an investment in Oklahoma communities. It will help ensure that rural hospitals get paid for the care that they provide. It will create jobs, which has its own economic stimulus effect. And it will put money back into our communities. And lastly, it's good for the state budget. Other states' experiences show that Medicaid expansion is going to generate savings for the state. So all of this is phenomenal, and we are so excited that it's finally happening. However, with just 99 days until coverage takes effect, we need to get this thing over the goal line, and we need to do it right so that as many Oklahomans as possible can get the health care that they need and ensure that public money is well spent. So that means that Oklahoma needs to fund Medicaid expansion without taking from other core services. Again, Oklahoma can and should fund Medicaid expansion without taking from other core services. And because Oklahomans didn't vote to cut education, they didn't vote to cut other healthcare services, they voted to expand coverage. And in order to make this program accessible for everyone who is eligible, in addition to fully funding without cutting from other services, Oklahoma should allow people to apply for coverage before expansion takes effect. Right now, the state is planning to open up eligibility on the same day that coverage actually begins. But this could create lots of unnecessary confusion. It could create rush for providers, for nonprofits, for other community organizations, and for expansion members, and even for the Medicaid agency, OHCA. We can pace this out, and that will make it more successful. For example, in Idaho, when they expanded Medicaid, 2 in 3 expansion enrollees were signed up for coverage before that coverage even took effect. Opening enrollment before coverage begins will give everyone involved time to slow down, to make good decisions, and minimize confusion. It will streamline access to care for people who really, really need it. But if that simply can't be done, OHCA should reprocess applications that are submitted from April 1st to July 1st to redetermine eligibility, to see if those previously denied applicants are now eligible under Medicaid expansion. And lastly, OHCA should be really intentional about ensuring that people know this is something they're eligible for now, particularly people who may be less connected to traditional news sources or to social media. It's like planning a party in the pre-COVID times. You text some people, you email some people, you call others, and you have a Facebook event. So you do whatever you need to do to make sure everyone knows that this is happening. So it's very important that OHCA has an outreach plan and it reaches out to communities that need to know that they're now eligible for this health coverage. So that's enough for me. We have a lot of speakers who can speak about how expansion will impact them and their communities. So first up, we're going to hear from Millie Daniels about how getting Medicaid has changed her life's path.
Hello, my name is Millie Daniels. I'm a workers' compensation attorney and a personal injury attorney, and I support Medicaid because Medicaid saved my life. I became pregnant unexpectedly when I was uninsured, and following that pregnancy was diagnosed with breast cancer almost immediately, and was still uninsured. And without Medicaid, I genuinely do not know how I would have survived, number one. Number two, I don't know, even if I had physically been able to beat the cancer without having access to all the wonderful care that I did through Medicaid, I don't know how I would have financially survived. And I think the stress of that financial burden and all of the surgeries and the treatments and caring for my brand new baby and all those things, I think it just would have changed my life in a negative way to such an extent that I almost can't even let my mind go there. If I hadn't had Medicaid and been able to overcome those financial burdens and get back into the workplace, I wouldn't have access to privatized healthcare. I think that what people should understand is that, at least the opponents of programs like Medicaid, I think they look at the cost, which is absolutely, that's what it is. It costs money, but the greater costs are when we don't lift people up in a time of need and put them back into the workforce and making them productive earners in our society. The passage of 802 in Oklahoma, to me, means that federal tax dollars are coming back to Oklahoma, which is so important. And so many Oklahomans that may not, even as they sit here today, or even as they voted, whether they voted yes or no on 802, the reality is, unfortunately, a significant number of those people are going to, at some point, need to rely on the services of Medicaid. And I am beyond thrilled that there's going to be an option there when tragedy strikes for so many Oklahomans, as unfortunately we know it just does.
Thank you, Millie. I always love hearing her story. It's very powerful, and we want to say thank you for being willing to share that. So for our next clip, we're going to hear about the business case for expansion. Shelly Academy is a partner in the Matisse Group. She's an expert in economic development and a longtime proponent of Medicaid expansion. In this clip, she's going to talk about why Medicaid expansion is a good business decision.
Hello, I'm Shelly Academy. I'm a partner with the Matisse Group, an Oklahoma City headquartered consulting firm. I did economic development in Oklahoma for about 25 years before joining the Matisse Group 2 years ago. I am passionate about this issue because it is just huge on so many levels. It is a huge positive economic impact. And then from a social justice perspective, it's important. And just from common sense perspective, it is so important. So first off, I think anybody who owns or runs a business knows how important workforce is. And workforce has just gotten more and more and more important over the last 5 or 10 years. It doesn't matter what industry you're in, your workforce is vital. And having people show up and bring their whole selves to work and be productive is a very important part of any healthy company. People who are physically and mentally and emotionally healthy are much more likely to get a job, keep a job, and be productive on that job. And so for the business community, I feel like Medicaid expansion means that people who own and run businesses will be more likely to find good workers, retain those good workers, and have good workers be really productive on the job. And again, I'm sure OK Policy can share all the statistics about that. But I think anybody who's managed a team just knows intuitively that that is the case. And with Medicaid expansion, of course, healthcare coverage comes to many, many more people, many more people than receive it currently. Secondly, when Medicaid expansion happens, Oklahoma benefits because of all the federal dollars that pour into the state. So for those companies that are specifically part of the healthcare industry, they certainly benefit. They benefit directly when those federal dollars pour into their companies. That's hospitals. Which certainly hospitals could benefit now, especially from that influx of federal dollars. But also there are multiplier effects that will impact all companies in Oklahoma. So not just companies that are healthcare related, but all companies in Oklahoma. And I just think that's so important. Why would we not accept lots and lots of money from outside the state? Outside the state, meaning federal dollars pouring into the state of Oklahoma. So there are many reasons to do this. I think the top two, for the business industry, are the super positive workforce impacts and the super positive economic impacts. Again, I appreciate the opportunity. I appreciate everything Oklahoma policy does. And I'm excited to hear what the other speakers have to say. Thank you.
Thank you, Shelly, for making that case for us. And next up, we'll have Bailey Perkins. She'll be live with us today. Bailey is the State Advocacy and Public Policy Director for the Oklahoma Food Banks, and she's going to talk through what Medicaid expansion will mean for the food banks clients.
Hello, thank you so much, Emma, for the introduction. As mentioned, my name is Bailey Perkins, State Advocacy and Public Policy Director for Oklahoma Food Banks. I'm here today representing Regional Food Bank of Oklahoma and Community Food Bank of Eastern Oklahoma because we care about the multidimensional root causes of hunger, with health and access to care being among them. In our state, 1 in 6 people and 1 in 4 children face food insecurity. Those same Oklahomans struggle with social, economic, and health disparities too. We believe in not only feeding the line or being there to provide emergency food assistance and resources in people's time of need, but as equally shortening the line, doing what it takes structurally and systemically to reduce the need for food assistance. Extending health coverage to more than 200,000 Oklahomans helps us shorten the line and, most importantly, save lives. Too many of the people we serve lack health coverage and can't afford to see a doctor. Many clients are forced to choose whether to pay a bill, feed their families, or purchase life-saving prescription medicines. The COVID-19 pandemic created a number of challenges for communities and exacerbated the false options many people already faced. Hard-working Oklahomans found themselves in the middle of a crossroad when some lost jobs from their employers closing their doors, losing hours at work because of the pandemic, or even being laid off because of the economic downturn. People who relied on their employer for income and health coverage now found themselves for the first time in the gap. Our network of more than 1,300 partner pantries and agencies served people who fit that description. We experienced a 30% increase in need, and we saw an uptick of people who never needed food assistance before. Many uninsured, low-wage earners found themselves on the front lines of this crisis that ravaged our communities because they had no choice but to put their lives at risk to keep food on the table. We're talking human rights and public health needs, y'all. That's where Medicaid expansion comes in. Medicaid expansion takes the burden off of Oklahomans struggling to make ends meet, and it builds our healthcare infrastructure to keep hospitals and medical services available, affordable, and accessible. It's for the mother who needed a preventative health screening, but pushed it off in fear of a medical bill. It's for the diabetic who rationed his insulin because he lost coverage. It's for the person who, for the first time in their life, is getting that need checked because they could never afford to go anywhere but the emergency room before. A few months ago, I lost a friend at the tender age of 33 who had an unmet health challenge and didn't have insurance to see a doctor about it. I often think about whether he'd still be with us if he could have afforded care. Medicaid expansion ensures that fewer people have to think about that. Oklahoma voters gave their neighbors a hand up in these difficult seasons and real options and support for health care. States that have passed Medicaid expansion see rippling benefits. For instance, we know that when parents participate in programs, they're more likely to get their children signed up for care. So expanding health coverage means that we help families and we help kids too. A study by the National Institute of Health concludes that providing free or low-cost health insurance coverage frees up household funds, reducing food insecurity, and improving important social determinants of health. Because of this, we see Medicaid expansion as a critical piece of the fight against hunger and a real pathway towards self-sufficiency and healthy living. The only way we can see outcomes is if we do our part to help all eligible Oklahomans get enrolled. So we call upon Oklahomans who qualify for a family of four. That means anyone earning less than $36,570 a year to sign up for coverage. For those tuning in, you can help by spreading the word about Medicaid enrollment and encouraging those around you to get covered. Thank you, Oklahoma Policy Institute, and all involved in this opportunity to rally as we count down for coverage.
Thank you so much, Bailey, for giving that message and for being with us here today. And finally, I get to introduce the Reverend Dr. Tiffany A. Nagel-Monroe, who is a pastor at St. Paul's United Methodist Church in Shawnee, and she'll bring us home.
Good morning. It's wonderful to be with all of you this morning and to get to talk a little bit as to why it's so important for faith communities to care about the expansion of Medicaid. We are all born with sacred worth. This is something that is shared across the religious spectrum, this understanding that each of us are sacred and valuable. We're each born into this world with the same needs for love and having our basic needs met. Unfortunately, we're not all born with the same access to the same opportunities. Medicaid expansion is something we have seen the need for every time our state is crippled by a natural disaster, a new tornado, high winds come through, and we see injuries and we see medical needs that are just not being met. We've also seen it a lot during this last year and the fullness of the pandemic. We've gotten to see how many people are in need of healthcare that just simply don't have it. Some of these people are our favorite neighbors, our friends, our family members, and our favorite essential workers who work in service industries that we love to see them in and we love to support them in. Did we realize how many of them do not have access to basic care? This kind of care on the behalf of faith communities is so important. It's essential to our very core calling to see one another as sacred individuals, to give ourselves into the care and service of the other. We are to do all the good we can and to do no harm and stay in love with God. And the best ways to do that is to serve one another. It reminds me of the old story of the starfish and the little boy. The little boy goes to the beach and an older man sees him and he's picking up one starfish this beach is covered with starfish that have all come up on it. And he picks up one and he throws it back into the ocean. And this older man sees him do this over and over again. And he finally asks, "What are you doing? You're wasting your time. You can't save all of these starfish." And the little boy picked up another one and said, it matters to this one as he threw it back into the ocean. Every person that we can care for, it matters. Their lives matter. Caring for their health matters. It is not just a moral responsibility, but an imperative. And for churches to work with government entities and partnerships with nonprofits, we will be able to do our very best work. Churches and religious organizations and houses of faith, we cannot carry the burden, the financial burden, to carry all of this. We often have the opportunity to meet surface level needs. We need to have the courage to step into the harder questions and really wrestle with them. The questions like, what is the root cause of this surface level need? How do we do more than just serve on the surface? How do we get into the justice work, the nitty gritty, hard, time consuming action of justice work? And that's what we're being called to. So as a member of the faith community, I rejoice in this movement to help more of our neighbors have a more fulfilling quality of life and have opportunities that they deserve to live the best life that they are called to. I look forward to being a part of more of this work and to seeing more of my neighbors healthier, happier, and holistically present.
Thank you so much, Reverend Dr. Monroe, for bringing us home and ending it for us. So I believe now we have time for a few questions. So to start, we have, how would a managed care model affect some of these steps recommended for the state to take, like letting people apply for coverage now and processing previously denied applications again? So this is a good question, but the important part here is that the mechanism by which expansion happens is less important than ensuring that it happens at all. So it's very important to prioritize outreach, and that doesn't necessarily have to do with managed care. Medicaid expansion and managed care are two different things, and we think it's very important that the OHCA right now be focusing on making sure that expansion is as successful as possible. And that means ensuring that people know what's available and how they can get access to that care. All right, the next question is, how do agencies prepare for this change? Another good question. This should actually be a fairly simple change to OHCA's eligibility and enrollment software. But the important part here is that the agency actually do that outreach and public-facing communication. So the internal change to the system probably won't take a lot of effort. The external communication is very important and should begin happening sooner rather than later. All right, do we have any other questions? Yes, how do people enroll in Medicaid? Very good question. People can enroll in Medicaid at mysoonercare.org or through their local DHS office. So you can visit that website to see if you qualify. And then if you have questions or are unsure if you qualify or need help navigating the application or just need general Medicaid assistance, Oklahoma has an enrollment navigator program. And so you can contact them at the email stephenbgoldman@gmail.com or at the phone number listed below, and they will be able to help. Okay, we've got a question for Reverend Dr. Monroe. How can Oklahomans of faith be involved in Medicaid expansion? See if we can bring up, yeah.
I think one of the best ways to get involved is start talking to your faith leaders, start talking to the people in your churches about how can we partner with agencies like Oklahoma Policy, and how can we help to be bearers of communication, getting the word out. Another great way is looking around your neighborhood in the area surrounding maybe a 5-mile radius of your particular house of worship, and start asking, how can we get this communication out in that 5-mile radius? Start with a small bite. If you are, or your house of faith serves people a meal, or they offer a clothing closet, a food closet, maybe they offer clinics at varieties of different times, see those as opportunities to make sure you're communicating how people can get connected, and how people can get these services and meet these needs. Part of our job is to be conduits and to be able to connect. We're connecting pieces. So I think that's the number one place to start as communities of faith. Care about it, recognize that it is one of the imperatives we're called to, and then ask your leaders and ask your community leaders, how can we get involved and how can we help lead?
Thank you so much for answering that. And I think we have one more question. Will people have to wait until July 1st to enroll, or can they pre-enroll? Good question. So like we talked about earlier, currently the plan is to open eligibility and therefore open applications on July 1, which is the same day that coverage begins. So we believe that it would make this transition much easier if people were allowed to pre-enroll. And so we are hoping that that change is made. Thank you for that question. We've got another question. Do mental health agencies need to panel with the 4 selected health insurance companies in order to continue to serve our clients? So I don't necessarily want to speak to like the logistics of managed care and how that will work, because I don't want to say anything incorrectly and I don't want to speak out of turn. I think the important thing for people that serve our Medicaid eligible members in Oklahoma is that they should continue to have the conversations and continue to advocate for what their clients and their patients need. All right, any other questions there? Okay, I think that's it. So that takes us to the end of our time together. Thank you all for joining us and for asking these really great questions. We will have more events coming up to count down the 99 days until Oklahomans can get the healthcare that they need. But in the meantime, you can help ensure that expansion implementation is done well by visiting okpolicy.org/countdown to take action. From this page, you can call and email legislators to tell them that you want Medicaid expansion to be implemented effectively. And you can also share your Medicaid or healthcare story so that people will understand what's at stake. You can encourage your family and friends to share their story as well. And you can also find our upcoming events at the same page or on our social media sites. So keep an eye out for that and have a great day.